So I would like to welcome everybody to this webinar on how to address equity in systematic reviews. We are very privileged to have with us to present today's webinar Dr. Vivian Welsh, who's an affiliate researcher at Bruyere Research Institute and an associate professor at the School of Epidemiology and Public Health at University of Ottawa. Vivian's research interests are in assessing health equity in systematic reviews and guideline development. We also have Dr. Jennifer Petkovic, I hope I've said that right, who's the coordinator of the Campbell and Cochrane Equity Methods Group, and her research interests are in equity knowledge translation and priority setting. Before we start, I just want to let everyone know that you can ask a question by unmuting yourself or by texting it using the chat box function. But Jennifer and Vivian will let us know when they want to take questions. While the webinar is ongoing, please keep yourselves muted because otherwise it causes interference. And just to let you know, the session is being recorded. The slides will be available to all the participants after the webinar, and the presentation will also be, the recording of the presentation will also be made available on Cochrane South Africa's website. So I'm now going to hand over to Jennifer. Thanks.
Okay, perfect. For questions, you can ask them anytime throughout if something comes up, and maybe between sections we can just pause and see if there's anything that comes up. Okay, so for competing interests, just Vivian is the editor-in-chief of the Campbell collaboration. And we'd like to acknowledge that we receive funding for the Cochrane and Campbell Equity Methods Group from the Canadian Institutes of Health Research, from Cochrane, from the Rockefeller Foundation, and the Canada Research Chair in Health Equity. And also Vivian has an Ontario Early Researcher Award. And our affiliation is with the Bruyere Research Institute at the University of Ottawa. So the outline for this presentation will be a brief introduction to health equity, and then we'll talk about how you can include equity in all Cochrane reviews. We have a very brief section about equity-focused reviews, and then Vivian will take us through an example of equity in COVID-19 and what to include in your protocol. So what is health equity? The Cochrane and Campbell Equity Methods Group uses the definition by Margaret Whitehead, and that's that health equity is the absence of avoidable and unfair differences in health outcomes. And we present it this way because sometimes that helps think through the different components. So the first is that there's a difference in health outcomes. So for example, some people die from COVID-19 and some don't. And that difference could be unavoidable or could be potentially avoidable. And so, for example, for COVID-19, older people are more likely than younger people to die from COVID-19. And so if that's just related to age differences, then we would say that that's probably an unavoidable difference. But if that's related to other factors like ageism or potential discrimination against older people, then that might be considered potentially avoidable difference, and we might consider that to be unfair. There are potentially avoidable but acceptable differences in health outcomes, and so that would be something like if somebody's injured in a skiing accident and they've chosen to go skiing and they get hurt, then we would probably say that that was avoidable, but it's not unacceptable. That would be an acceptable difference. And this image has been used to describe the differences between the terms equality and equity, because these terms are sometimes used interchangeably, but we think there's actually a difference. So on the left presents equality, and in this image, all three of these people have been given a crate to help them achieve their health outcome, or in this case, see over the fence to see the game, but that hasn't actually helped everybody. And on the right, the image about equity shows that the crates have been redistributed. So the shortest person who needed the most help to see over the fence has received 2 crates, and the person who could already see over the fence hasn't received any. And so that's helped everybody achieve the health outcome. So this is a new image that we've just found. So basically this is describing a similar concept. It's hard to read because the text on the green is also green, but this new image shows a similar concept. So this time there's a focus on structural and systemic changes that would be needed to help balance the tree. So the first 2 images are similar, that there's a difference in access. And then with equity, the child on the right has received a taller ladder. But in the last picture in justice, the tree has been straightened so that the access is equal for everybody, and the tools and opportunities are there. Okay, so who might be considered disadvantaged? The equity group, we use this acronym PROGRESS to help Cochrane Review authors think about the different population characteristics that could contribute to disadvantage. So PROGRESS stands for place of residence, which includes the country in which somebody lives, but also whether they're living in a rural or urban neighborhood or different regions that might experience health differently. Race, ethnicity, culture, and language, occupation, gender and sex, religion, education, socioeconomic status, and social capital. And you can think about how these characteristics might contribute to inequities. So for example, for place of residence, in rural areas, sometimes there's lower access to health services just because of the distance to a health facility, but there might also be reduced access to specialist care, which can have some effects on health equity. And then for race, ethnicity, culture, and language, some ethnic communities have been racialized through discrimination and racism, and that affects their health opportunities and health outcomes, and these differences could be perpetuated through generations. For occupation, this refers to the type of work that somebody has, but also whether they are unemployed or out of work. And you can think that some informal workers have reduced access to protective equipment, which would increase their risk for workplace-related injuries or death. For gender and sex, so just one example is that there's lower rates of hip replacement surgery for women when they present with the same severity of disease as men, and that's related to a complex system of sort of unconscious bias and discrimination and gender roles that affects decisions of both the patients as well as the healthcare providers. Religious affiliation or lack of religious affiliation can limit access to services and contribute to inequities. For education, higher educational attainment has been associated with better health outcomes, and the availability and choice of education might be dependent on other contextual factors like economic and political situations, which can make these differences inequitable. Socioeconomic status, so people with lower socioeconomic status have greater morbidity and may have shorter life expectancy. That's related to a lot of factors such as access to nutritious food, access to health services. And social capital, which refers to a person's social networks and their connection to their community. It can have an impact on health equity if individuals experiencing social isolation have higher death rates that compared to those who have adequate support. So for your Cochrane, and Progress Plus, you may have noticed that those characteristics don't actually capture everything that you might be interested in for your population in your review. So Progress Plus has 3 additional categories. The first is additional personal characteristics, so things like age or disability. So you might think that there are different or additional characteristics that you would want to include in your review based on the context or the intervention that you're interested in. The second category is features of relationships. So this is, for example, things like a child who's living in a home with parents who smoke, or a woman who's in an abusive relationship, and how those might impact health outcomes. And then the third is time-dependent relationships. So this is for capturing people who might not usually be considered disadvantaged or experiencing inequities, but for a short period of time they are. So for example, if someone's just been discharged from the hospital and they would require additional supports or assistive devices and they can't access those, then they might be disadvantaged temporarily. So there are many stakeholders who would be interested in the results of your review or using your review. And they're the typical ones that we think about with our Cochrane reviews, like patients and healthcare providers and policymakers, but other stakeholders might also be interested. So for example, the public, people who fund research, people who make drugs or devices, program managers or those who are planning programs, and other researchers and their teams might also have an interest in using the results of your review. Okay, so we've just gone through the introduction to equity. I can pause here and see if anybody has any questions before we move on to how you can consider equity in all reviews. Okay, I'll continue. So for systematic reviews, we often think about presenting the average results, but that for health equity can sometimes leave us without information for what's happening for populations that are underrepresented or disadvantaged, or the marginalized groups within the population. So a couple things that we ask review authors to think about is everyone receiving the same benefit from the intervention? And does the intervention work in the disadvantaged populations? So it's important for Cochrane reviews to think about health equity, because Cochrane reviews are used globally to improve decision-making and policy-making. And so systematic review authors need to think about how the results of their review might be applicable in other contexts or other settings. So as we've just discussed, average results can hide the differences in effects between population groups. So planning how you might extract and analyze that data about these potential differences will help with our understanding of the intervention and its effectiveness. And then we like to mention just two important things. So the first is, if you plan to assess health equity in your review, but you're not able to report on any results, then that's an important finding to report. So no available data is important, because then we can use that towards planning future studies, or help to indicate that primary studies need to be presenting disaggregated results. And the second is, if you are able to make equity assessments and you don't find any difference, then that's also important, because then we know that we don't maybe have to worry if there's differences in the effectiveness of the intervention for different population groups. So there are 4 ways that Cochrane authors can think about health equity in their reviews, and we'll go through each of these with a couple slides later, but I'll just present the overview. So the first is that we can think about health equity right at the beginning when we're forming our question, and you might consider using a logic model, and I'll tell you about a logic model in a moment. The second is that review authors should also think about the methods they're going to use and plan to identify and appraise equity. And then the third is to think about your summary of findings table and whether you might present the equity considerations in a separate table or in separate rows. And then the fourth is to think about how you might interpret your findings and the potential effects on health equity, and you can do that in your discussion section. So first, a logic model. So logic models are also sometimes called causal pathways or analytic frameworks, if you've seen them that way. This is a complicated logic model. I will say that we have a Cochrane Interactive Learning module. It's module 11, and in it there's a video walking the users through this logic model and how it works. I won't present the video now, but I'll just tell you that you can see here in the logic model, this is a logic model for interventions to improve or to reduce inequities in cataract outcomes. So the review focused on improving access to cataract surgical services, but the logic model presents all interventions. So the first shows who might be involved in planning interventions. Then there's the structural interventions, and you can see that equity is here in the policy and planning structural interventions. And then these lead into the intermediary interventions. In our case, we were looking at health service access interventions, and how these might, how improving access might then improve cataract surgical services and increase the rate of surgical services for cataracts, and that could reduce inequities. The next important point was methods. So how to think about identifying and appraising evidence for equity in your review. So to decide on what methods you'll use to assess equity in your review, we think there are 3 things that you could consider. So the first thing is to think about whether the population or groups within your population might be experiencing health inequities related to the condition or the problem that you're interested in. So are there differences in the baseline risk of the condition or the problem? Then the second is to think about whether there could be inequities related to the intervention that you're planning, and whether everybody would be able to access the intervention the same way. And then the third is to think of whether there are differences in, or whether there's a social gradient in the burden of disease. And so are there likely to be differences in the absolute or relative effects? So we think you could consider these and decide how you'll plan your methods and report on that in your review. And at the very least, we suggest adding a section to the background where you can describe the populations and the differences that might affect them in your background section. So the third is the summary of findings table. So we have an example. This is an example of the Cochrane Review for Preventing Rotavirus Diarrhea. And in this review, they've actually presented 2 summary findings tables. So the first one looks at the results for low mortality countries, and the second table looks at the results for high mortality countries. And so you can see here there's a difference in the absolute effect. So the severe cases of rotavirus diarrhea, there was a greater absolute effect where there was higher baseline risk. And then finally, how you can interpret your review findings and their potential effects on health equity in the discussion section. So here you could consider in the section on overall completeness and applicability of your findings, you can determine or report on the context in which the studies that you've included were conducted and how that might apply to other settings and other contexts. And so, for example, there's a Cochrane review on lay health workers. And so in their discussion, they just wrote that the degree to which the findings from the studies in high income settings can be generalized to low income settings is unclear and would benefit from further research. And then, okay, I can take a pause, I guess, to see if there's any questions before we go into equity-focused reviews.
There was a comment from Prof. Chikta about that says the issue is around the intersectionality of these items. I don't know if you want to say something else about your comment, Yusuf? Is he still here? Oh, no, we can't hear you. I'm trying to find you in the list of participants.
I think Yusuf is still on mute.
Oh. Let me try it. Well, I think we can get back to that comment later, perhaps. I don't think there are any other questions now.
Okay. Sure, we can come back to it. Okay, we will come back to it. So, so we've gone through how all Cochrane reviews could think about equity, but then there would be also some reviews that would be more equity focused, that are looking at disadvantaged populations, or could potentially assess differences in the population. So we define an equity focused review as one that aims to assess the effects of the intervention on a targeted or disadvantaged population, or one that the intervention will affect the social gradients across populations or within subgroups of the population. And so we have other resources if you are doing an equity focused review and would like a bit more guidance. But just briefly, we can tell you a few things. So when you're doing an equity focused review, you might want to think about including different study designs. So some equity questions might need you to use non-randomized study designs. That might be an additional step to think about in planning your review. Then to identify eligible studies, you might want to consider additional databases. So for example, some journals that present evidence from low and middle income countries might be published in different databases than those that are in the standard list of Cochrane review databases. And the Cochrane EPOC group was keeping a list of potential resources on their website. And then the last is assessing the context and process. So how the context and process might affect the intervention. That can be done using standard equity or standard systematic review methods such as meta-analysis, but you'd want to plan that up front. And then the next is to go into an example of equity in COVID-19. And so I will pass over to Vivian.
Hi, thanks, Jennifer. I guess is it okay if I just ask about the slides going ahead, because I don't have control, I think, of the slides? Is that okay, Jennifer?
Yeah, I can be the slide manager.
Okay. I guess, okay, well, it's a real pleasure to be here. So thank you, Solange, for inviting us. I just want to cover a few points about equity and COVID-19, given this challenge that the world is facing. We just published an article in the Journal of Clinical Epidemiology, which lays out a framework for thinking about the potential equity harms of COVID-19 and how to assess the effectiveness of interventions, taking into account equity harms. And this was led by Rebecca Glover. Maybe, I think, next slide, please, Jennifer. So this is quite a lot to digest, so I'll try to go slowly on this slide. What we've done with this framework is on the left side, you see all the factors of Progress Plus. And on the top, the columns, the middle column is actually a framework borrowed from Theo Lorenc and David Ogilvy, which looks at physical, psychological, social group harms and opportunity costs. And what we've done is a purposeful sampling in this article of examples of COVID-19 policies and examples of interventions that have been put in place to mitigate those equity harms. So, for example, here, this is a table for high-income country settings. In the article, we managed with small font to fit high-income and low-income countries into the same table, but not on the PowerPoint slide. So if you have a look on the left at the row for education, you can see that the COVID-19 policy of school closures, there are a number of potential equity harms like food insecurity from the absence of school meals, family stress with children at home, and potential inequities in homeschooling and learning. So one potential intervention is online learning and support, but there would be other interventions to address other equity harms, such as cash transfers to families and support. I guess as another example, if you look at age on the left, the elderly have been encouraged to self-isolate in many countries. There's a risk of reduced health and social care, and things like vaccination programs may be suspended. So some potential interventions are support lines and access to safe care. So I guess maybe on the next slide, we've laid out the same framework, but thinking from a low middle income country context. So for example, on the left, the place of residence. In some countries, people in shanty towns have been targeted or closed in. And these result in harms of unemployment, mental health, loss of family income. So some potential interventions are cash transfers, providing food, supplies, and better housing. I hope that gives you an idea of what we've thought about in that framework. We really hope that framework can be used to formulate questions and methods to address equity in systematic reviews going forward. Sorry, Jennifer, the next slide is okay. So what we've done here is to give some examples of COVID-19 relevant reviews. So there's a real need to think about COVID-19 relevant reviews and COVID-19 specific reviews. And when we're thinking about equity, a number of these social and economic responses can be informed by existing Cochrane and Campbell reviews. So this is an example of a published Cochrane review on reducing hazardous and harmful alcohol consumption. And of course, this is relevant in the context of COVID-19 because there is an increase in alcohol consumption in many countries. And this, what we've done is shown in these 4 bullet points how this review actually approaches the 4 methods of thinking about equity that Jennifer has already described. So first, the rationale is based in how there may be differences in effectiveness of digital interventions across progress plus factors, age, gender, ethnicity, and socioeconomic status. And I certainly agree with Yusuf that we need to think about how these factors intersect with each other. And in the methods, this systematic review planned to do a separate subgroup analysis for low socioeconomic status and high socioeconomic status populations. That wasn't possible, but the review does discuss the relevance of the findings across socioeconomic status, given there's little evidence from the study. Next slide. So this is a Campbell systematic review, and I already declared my conflicts of interest as editor-in-chief at Campbell. But of course, in the economic and social response to COVID-19, we need to think about social and economic interventions. This is an example of a COVID-19 relevant review, which was published 3 years ago in 2017 on improving labor market outcomes for youth. So how to get youth employed. And this is relevant in the time of COVID-19 with losses of jobs and employment opportunities for youth. So in the rationale of this review, they use a results chain, a causal chain, to explain the rationale for the review about how some of these programs target the poorest and most socially disadvantaged youth. In the methods, this review collected details on several progress plus factors, age, gender, educational level, and income, and did a moderator analysis across these factors. And in the summary findings, this review did find that these programs were more effective when they were focused on socially disadvantaged youth. So those in low and middle income countries, there were larger effects. For women, there were larger effects, and for low income youth versus high income youth. So in the interpretation, this review talks about the implications for designing and targeting programs to have the most benefit. The next slide. So many of you probably know that Cochrane has implemented a rapid review program to respond to the COVID-19 pandemic. This is one of the rapid reviews that has just come out, I think, last week on video calls for reducing social isolation and loneliness in older people. I know we think of this as an equity-focused review that is relevant to the COVID-19 response because older people in nursing care homes and long-term care are really in a vulnerable position where they may be socially isolated and lonely, especially with restrictions on movement and visits. So this review sets out that rationale about how older adults are in a position of social isolation. The methods are focused on older people, so it's really a equity-focused review. And the summary findings, this review found that video calls had little or no effect on loneliness. But the results, the interpretation was quite uncertain because of the very little evidence, and really a need for more diverse and representative participants in these kinds of studies. Next slide, please. So I guess we just wanted to end with what to think about when you're you're writing up your protocol and forming your question. And just next slide, please. Really covering the points that we've covered already. Is the first thing to think about is creating a heading in your background about the relevance of health equity. So you might assess whether there's a greater burden of the disease or condition in certain population groups. You might think about whether there's potential for different effectiveness or adherence to interventions. And you might think about outcomes. So what are the important outcomes for specific populations, such as inconvenience, stigma, return to work, ability to work. And then thinking about these, I think we propose will drive how you design your method section to answer those questions. Next slide. So I think in conclusion, we want to repeat in the new equity chapter in the Cochrane Handbook. We really suggest to focus on the question formulation, possibly with the logic model. Think about what methods you might use to answer your questions about equity. So those could be subgroup analyses, but they may also be analyses to understand gradients in effect, or explore the process of implementation, how that differs. The third thing is the summary findings tables, especially in Cochrane reviews. The summary findings table is really upfront in the Cochrane review, and it's an opportunity to really highlight findings or lack of findings about equity. And the fourth is to think about implications for equity in the implications for research and implications for policy. Next slide, please. So we have a number of resources on our website at Cochrane Equity Resources, and really encourage you to have a look at these resources. One is an equity checklist for planning equity in your review. The second is details about the Progress Plus framework. The third resource here is the Prisma Equity Extension, which we developed for equity-focused reviews. And we also have links to Chapter 16 on equity in the Cochrane Handbook and the interactive learning module, which Jennifer just mentioned was just recently published with Cochrane. Next slide, please. And you'll have access to these slides. So there's a few references here about our work that may be helpful. And we'd also like to acknowledge the many people who've helped the equity group over the years, but particularly Stephanie Clench, who helped to put together these slides, Jordi Pardo, and Dario Samujag, and additional colleagues who've helped really with the equity work over the years. The last slide. Yeah. So we wanted to leave lots of time for questions, and hope that we've left enough time here, Solange.
Thanks, Vivian. I think so. So if anyone has, thanks so much for that great presentation about the work on COVID-19 and what has happened because of it and because of the containment measures that have been put in place and what we can do to address those is really interesting. And we've seen how it has affected different social classes and so forth differently. So if anyone has a question, you can unmute yourself and ask your question, or you can write your question in the chat box. Perhaps while we wait for someone to ask a question, I just wanted to comment on how difficult it is sometimes to get information on the progress characteristic items when you do a review. And so this makes the ability of actually assessing the effect according to different equity categories quite difficult because the primary studies reported so poorly.
Yeah, I think that's a great point, Solange. We've certainly encountered that challenge of collecting information about progress plus factors from primary studies. One thing we suggested with the Prisma Equity extension is to think about including the progress plus factors or the relevant ones in your data collection forms, because it's a way to really systematize documenting that information.
Yeah, definitely. Yusuf, would you like to comment on your previous query?
Am I back on? Can you hear me now?
We can hear you, yes.
Yes.
Thanks. Yeah, I think the issue around categorizing the different items or elements or criteria for equity is that they don't operate singly, and they operate intersectionally, and it's often very difficult to weigh to combine the synergistic effects of, say, for instance, race, class, and ableism, or gender, or disability. And I think there may be stratifications along those lines if one engages and measures that. The other issue is that what we often leave out is the difficulty is to look at the impact of transgenerational equity. You know, I may be in a certain group now, but I may not be in a group later on, or within a generation. But the residues of discrimination or the effect of having belonged previously is not always easy to capture. So I just wanted to bring that debate into this discussion. Thank you.
Thank you for the comment. We totally agree. I think that we propose the Progress Plus framework as a way to think about all the possible categories. But I think thinking about intersectionality is really important for some of these questions. We've actually been involved with a researcher in India who's interested in doing a method survey of how systematic reviews have thought about intersectionality, especially of race and class. You know, we'd love to see more work on this. I think in Cochrane, there's an increasing number of reviews that are focused on Indigenous people, and the extent to which they're able to think about transgenerational equity and discrimination. I'm not sure how they can capture that, but I think it's a positive move to have more reviews like that in the Cochrane Library. And it definitely raises questions for how Cochrane reviews and what methods are needed to take that into consideration.
Yeah. Can I just continue on that if I have a couple of seconds? Yeah. It's interesting the way the COVID data is presented in South Africa in a race-blind way. Now, in the States and in the UK, there are certain sections of the population who experience higher levels of risk and morbidity. But the way in which the data is presented in South Africa is not presented around many of the items around inequity that you've raised. And we saw between the sensitivity of using the effects of racism and using a category which is which in South Africa people don't like to use under most circumstances, and when it is used, it's used insensitive, not very sensitively.
Yeah, I think that's a great point. I mean, thinking about how Cochrane can take this on, with the rapid review initiative in Cochrane, there has been openness to different types of reviews. I think we had a discussion about a review on social determinants and COVID-19 related to incidence and exposure. So I mean, I think there's a big need there. It's one of the priority questions in the Cochrane Rapid Review Priority Bank is around equity harms of vulnerable populations across well, all social determinants, ethnicity and race included. So thank you for that comment. I see some questions in the chat.
Yeah. So there is a question from Home about whether there's any Cochrane study about health equity in Indigenous populations worldwide focused on cognitive impairment or decline.
I'm not aware of any, but Jennifer, are you aware of any?
No, I'm not aware of any either.
I mean, Cochrane doesn't usually look at incidents. As all of you know, it's mostly focused on questions about effectiveness of interventions. The one review that I know about Indigenous populations, and I think there are others, but was about child and family services for Indigenous populations, and it was being led from a postdoctoral fellow in Australia. But I have seen some other titles related to Indigenous populations in the Cochrane Library.
Thanks. Then there's a question from Eleanor about if there are special considerations to structure the PICO for equity reviews.
Maybe Jennifer, would you like to take this one? Jennifer. I think for structuring the PICO, so I think in defining the population, we would encourage to think about whether there are specific populations that are excluded from studies because of how research studies often exclude older adults, people with comorbidities, and so on. The intervention, I think, as we mentioned, that we encourage people to think about whether there are inequities in access to an intervention or in potentially adherence to an intervention or effectiveness of an intervention. In the comparison, I think when we've talked about equity reviews, it's really important to think about the comparison because when you think about decision makers, they like to know about the most effective alternative options. And actually thinking about comparators such as usual care, those may be, or placebo, those may be not the relevant comparison. So I think we've never articulated how to choose a comparator, but I think that's important thought about the comparator in equity reviews. And the outcomes, as we mentioned, the importance of outcomes may differ for different populations. And people doing an equity focused review might really want to engage with relevant stakeholders to understand what those differences might be. So what are the important outcomes for the people and populations who are affected by that condition under study?
Thanks, Vivian. Are there any other questions? Okay. I guess not. Then I'd like to thank Jennifer and Vivian very much for facilitating, for presenting in the webinar today. Very interesting work. And as I said before, I will share the slides with all the participants, and then the recording of the webinar will be available in Cochrane South Africa's website. Thank you very much, and have a rest.
Great.
Enjoy the rest of your Friday.
Thank you, Solange. And you know, we're very interested in working with people, so please do get in touch with us if you're interested, you know, using these resources or designing an equity-focused question. We'd really be interested to collaborate.
That's great. Thank you. Right. Bye-bye.
Thank you. Bye.